professionals. With all the uncertainty in the world right now, self-care is more important than ever. The goal of this series is that you walk away with some tips that you can implement into your own lives to support your own wellness. Tonight's topic is a look at factors currently contributing to burnout in the healthcare profession and tips to avoid it, which feels especially applicable in difficult times like now. And now, I have the honor and privilege of introducing tonight's speakers. Dr. McDevitt is an assistant professor in the physical therapy program at the University of Colorado. She's been practicing as a physical therapist for 20 years. Clinically, she practices at the University of Colorado Health CU Sports Physical Therapy and Rehabilitation Clinic. She's a board-certified orthopedic clinical specialist and a fellow in the American Academy of Orthopedic Manual Physical Therapists. She teaches entry-level Doctor of Physical Therapy students and is currently completing her clinical PhD through the University of Newcastle, Australia. Amy is active in clinical and educational research at the University of Colorado Anschutz, and her research interests include musculoskeletal pain, shoulder pain, regional interdependence, dry needling, and assessment of clinical reasoning in physical therapy students. Dr. Mintken is a professor in the physical therapy program at the University of Colorado as well. He maintains an active research agenda investigating conservative care for musculoskeletal disorders. He has over 50 peer-reviewed publications and has co-authored 3 ebooks and 7 chapters. His awards include the Gold Excellence in Teaching Orthopedic Physical Therapy Award from the APTA, the Bathke-Carlin Award for Excellence in Academic Teaching from the APTA, the Rose Excellence in Research Award, the Journal of Orthopedic and Sports Physical Therapy Excellence in Research Award, the Chattanooga Research Award from the Physical Therapy Journal, and the Outstanding Physical Therapist Award for the state of Colorado from the Colorado chapter of the APTA. And now I will pass the virtual mic over to Dr. Mintken and Dr. McDevitt.
So thank you for all of us who are here attending this webinar. And to provide a little bit of context, this information that we're going to be presenting was really born out of a larger presentation that Paul and I did nationally with 2 of our other colleagues on burnout. And as many of you probably already know, that burnout is really a topic that's being talked about, and it's really experienced across many health professions. And a lot of the content that we're going to be presenting is really coming out of not just physical therapy literature, but literature in medicine and in nursing. So many of us as healthcare providers took on an oath to do no harm to our patients, but sometimes it seems that upholding that vow is really at times creating harm to ourselves. And so we'd like to have a dialogue about burnout. Some of the objectives that we're going to cover, we're going to describe professional burnout. We are going to discuss factors that are currently contributing to burnout in the health professions, and then identify risk factors and signs of burnout so you can better recognize them in yourself, your colleagues, your students. And then we're going to talk about some strategies based on the source of burnout to really help providers from developing burnout in their careers. So what we'd like to know now, if you could go into the chat real quick and tell us what professions you all represent. We'd like to know a little bit more about who's here. So Paul, I'm going to have you go ahead and monitor that and call out some of the professions that are here in our webinar. Okay, it looks like we have physical therapy, we have people from pharmacy, fundraising, DPT students, nurse practitioner, physician assistant, healthcare consulting, RN. So we have representation from nursing. So it looks like you know, quite a breadth of providers are here in this webinar. So we really do hope that you can walk away with some information that's going to be helpful to you. Paul, I think I'm going to have you go ahead and advance. It doesn't look like I'm able to do that. And we'll go on to the next slide. So a number of you were given the Burnout Clinical Subtype Questionnaire. So this is one of many questionnaires that are out there. This one happens to be easily accessible. But those of you that were able to do this turned in 12 questions on burnout. And so within this particular questionnaire, there's 3 different domains. So I'm going to have Paul go ahead and advance forward. So this first domain is the overload domain, which is in red. The second domain is this lack of development. So really unable to develop professionally. That's the next domain. And the final domain is what's called neglect. So giving up on your responsibilities or throwing in the towel, so to speak. So if we move to the next slide, this is really how we panned out as a group. So for those that filled out the questionnaire, really where you fell is in the overload category. And so what the overload category shows is you have ambition and it's caused by this dire need to achieve goals, but you may be risking your own health and your private life really in pursuit of good results. Some other characteristics of the overload are you're highly motivated, but sometimes lack the ability to recognize what your own limitations are. So really, it was neat to see the results of this. In all, we like our professions. We feel supported in our work, but we might be doing a little bit too much of that. And that's probably why we fell out overall as a group into the overload category. So here, this is just an example of a few questions. And this one is really, this one talks about dedication that I invest in my work is more than what I should for my health. So here is kind of where we fell out as a group. In the next question, is there, I would like to be doing another job that is more challenging for my abilities. And so it was nice to see that the mean is a little bit more, this was about 2.2, 2.3. So we really like our job and we don't want a different job. And then on the next, I neglect my personal life when I pursue important achievements in my work. So the mean here was closer to 5. So we may have some characteristics of really neglecting personal health and self-care. And in the last, again, this is something that's in this overload category. I overlook my own needs to fulfill my work demands.
All right, so I'll do a little background on burnout for us. And just, my own personal history. I was a full-time clinician for 10 years and certainly got burned out treating patients every day. But the benefit of that job was that when I left work, my work stayed at work. As PTs, we're blessed in that we don't have to take pagers home and that type of thing. So when I got into academia, that changed. And my work was always with me from that point forward. One of my colleagues describes academia as a treadmill. Once you get on, you can never stop running. And that's kind of how I felt. So I burned the candle at both ends for about 10 years and really burned myself out, drank too much, didn't take care of my physical or mental health, got depressed. And so that really sparked my interest in, how do I get out of this situation that I'm in? So just by show of hands, using the raise hand in the chat, how many of you feel like you're experiencing symptoms of burnout? And I can't see how many hands are coming up, but Amy, can you see that?
No, yeah. I can't.
Okay, so assuming there's some of you out.
Yeah, I see it now.
Okay, what's it look like?
So yeah, it looks like people have we're guessing that some of the attendees are here for a reason. So I think that makes sense.
Yeah, you're hopefully in the right place here. So what is professional burnout and how common is it in healthcare professions? So burnout is now an officially medically recognized syndrome. There's an ICD-10 code and it's recognized by the World Health Organization. So Freudenberger was the first one to describe burnout syndrome way back in 1974. And his definition was a state of mental and physical exhaustion caused by one's professional life. And just based on the research, up to half of all healthcare providers experience burnout, and up to 60% of students, and I'll present some data that shows that it might actually be a little bit higher than that. So Maslach has done a lot of research on this and described 3 dimensions of burnout: emotional exhaustion, so feelings of being emotionally exhausted and having a lack of energy; depersonalization, so feelings of impersonal response towards the recipients of the service, whether you're in healthcare or any type of a job, really; and then reduced personal accomplishment or professional efficacy. So we all have these interpersonal and job-related stressors that are placed upon us, and any one of them can contribute to these 3 different dimensions, and this leads to physiological, psychological, and behavioral consequences. So the gold standard for measuring burnout is the MBI, the Maslach Burnout Inventory, and you can see the cutoffs here. In this instrument, you can get it online, but it is copyrighted, so we couldn't use it in this presentation. But if you're interested in your own symptoms, you can go just look this up and take it and see where you fall on these cutoffs. But this study by Derby that was published in the National Academy of Medicine in 2017 showed that up to 50% of physicians, 70% of nurses, 50% of physician assistants, 50% of PTs, and up to 75% of healthcare students are suffering from symptoms of burnout. And there's a lot of factors, and Amy's going to talk about a lot of those, but medical debt and increased documentation time, insurance requirements, things like that all contribute to that. And then our own personal things, taking care of ourselves, getting enough sleep, organizing our lives, things like that can contribute as well. So we're interested in physical therapists, and I know we have a fair amount of PTs online here, or PT students, and we're not immune to this either. So, up to half of PTs can be experiencing symptoms of burnout. And the interesting thing is it's not significantly associated with the years of practice, how long you've been practicing, or the number of patients you see during the day. So there's something kind of behind the scenes, and Amy will get into a little bit more detail on that. And again, staying specific to PT, but this is generalizable to all healthcare professions. It's not just an American thing. We see it all over the world. Healthcare providers tend to overextend themselves and do too much and not take care of themselves. So what can we do about that as individuals, which we'll get to a little bit later. When we talk about students, in medical students, there was a 2018 meta-analysis of over 16,000 medical students, and 44% suffered from symptoms of burnout. And it's even higher in residents. A 2016 study showed that up to 75% of residents experience symptoms of burnout. And we think that burnout starts in professional education. We all know when we went through our training, it's a highly stressful, intense environment, and can lead to not taking care of ourselves and just developing some of these bad habits just personally that can contribute to burnout. So if our students are burned out by the time they graduate, it doesn't bode well for their career overall. So we did a survey of our PT students last year, and 63% had anxiety. 20% had symptoms of depression, which matches the general population. But when we looked at resilience, 77% of our students had low resilience, which means how they bounce back from difficult situations and handle adversity and things like that. So, is there something we can do about that? And I'll talk about it later. So what are the consequences of burnout on the healthcare profession? Job dissatisfaction, job turnover, medical errors, negative attitudes towards patients, patient dissatisfaction, lack of energy and motivation. And then unfortunately, we take this home with us to our relationships, which can lead to depression, anxiety, substance abuse, and unfortunately, suicidal ideation. So looking specifically at physicians, up to 40% experience depression at some point in their careers, and their suicide rate is twice as high as the general population. It's even worse in nurses. 1 in 5 meet the diagnostic criteria for post-traumatic stress disorder, and they are 4 times more likely to commit suicide than the general population. So what are the consequences of your provider being burned out for the patient? So this systematic review and meta-analysis from JAMA in 2018 showed that burnout is associated with twice the odds of patient safety incidents, low professionalism by the provider, and ultimately low patient satisfaction. And if the provider has high depersonalization, one of those three dimensions of burnout, they were 4.5 times more likely to have low patient satisfaction. And unfortunately, being treated by a burned out provider is an independent predictor of healthcare associated infections, which, in today's environment with COVID is a significant thing. Also, increased patient mortality, and the interpersonal teamwork deteriorates, and this leads to errors as well. So if we look at the cost to society overall, it's estimated to be almost $7 billion annually, the result of burnout of healthcare providers. And that leads to a 200% increased odds of leaving the institution, reductions in productivity, and it's expensive to replace healthcare providers. To replace a nurse who leaves because of burnout is almost $90,000, and depending on the specialty in medicine, it can be up to $1 million to replace a physician provider. And this leads to higher rates of absenteeism, medical errors, and malpractice claims. So with that, I highlight some of these things that contribute to burnout. So bureaucratic tasks, almost 60%, spending too many hours at work, increased computerization, lack of respect from administrators and colleagues, insufficient compensation because medical debt can be so high, lack of control and autonomy, and so on. So I'd invite you now to use the chat function and type in the one or two things that you feel contribute most to your feelings of burnout. Sleep. What else? Long hours, productivity requirements, job is never done, rapid changes, volume overload, high patient expectations, charting and paperwork, expectations and not wanting to let others down. So lack of support from administration, paperwork, too many patients, lack of communication. So what's on the screen now is a word cloud of some of the commonly cited things that contribute to burnout in healthcare professionals. So go back over here. So with that, I'll turn it over to Amy and see if you can drive again, Amy. Here, try and click on just click on the main screen and then see if you can advance slides.
No. So I may have you try to share with me again while I'm starting up, and I'll try it one more time. So I think what a lot of you listed in the chat, a lot of that already ended up in the word cloud. So for me personally, I think my story is a little different from Paul. I felt like burnout for me happened really early within the first 5 years of my career. And as a physical therapist and a new graduate, I had come out of a master's degree program, and I quickly was just trying to get as smart as I possibly could. So I was in a transitional doctorate program. I was doing what's called a fellowship, which is just getting advanced training. I was also managing and directing a clinic, learning how to be a business manager at the same time as I was treating 36 to 38 hours of patients per week. And, it just all came crashing down on me. And at the time, I wasn't sure if I even liked my profession. I just knew I had to get out. And so I gave my notice and I went to Costa Rica, and I worked with some physical therapists down there. And then that was subsequently followed by a trip to China where I did the same thing. And I think part of that was just trying to recalibrate and figure out, what I wanted to do and if this was even the profession that I wanted to be in anymore. So what I'm going to talk about are some of the risk factors that are associated with burnout as a condition. Okay, it looks like I can't drive. So Paul, I'm going to send it back over. So according to the World Health Organization, a risk factor is any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease or an injury. And so knowing what your risk factor is might actually be crucial to really trying to figure out what are some of the solutions that we can match with those risk factors. This is a great article. It's called Beyond Burnout, a Physician Wellness Hierarchy Designed to Prioritize Interventions at the Systems Level. So a lot of what Paul and I are going to focus on today are things that you can do as an individual, but where the rubber hits the road, it really needs to come from the organization or more at the systems level. So this was kind of an adaptation of Maslow's hierarchy. And it was really adapted for physicians, but I think it really does speak across health professions. And so if we look at this, there's some, at level 1 in the beginning, there's some basic needs that we have. We need to be hydrated. We need to have sleep. We need to have access to bathrooms. We need to be free of substance use and free of things like depression and anxiety. At the level of safety in green, you need to be physically safe. You need to be safe from your patients sometimes, and your patients need to be safe. You also need to have a sense that you have job security. That's followed by the next level, which is respect. And so there's a basic level of mutual respect that needs to occur between colleagues and between patient and provider. And something that I found interesting in this article is that you need respect from your EHR or your electronic health records. So we can be disrespected by inanimate objects, believe it or not, because when the EHR system makes you stay hours after your shift in order to finish documentation, that threatens the respect domain. Next on the list is appreciation. So do you feel appreciated, not just by your patients, but your peers, your supervisors? Do you feel noticed? And does your compensation match that appreciation? And then at the final level, it's heal patients and contribute. And what that means is, do you have the time, the autonomy, and the resources needed to actually heal your patients? And included with that, do you have the time to even think about, how you're practicing clinically and what you need to excel in your profession? So one of the things that can be problematic, I'm going to go ahead and just kind of run through a number of risk factors, but high workload demand. So that's something that a number of you have already listed up in the chat. So high productivity standards, high volume of patients, pressures having to do with time, lack of breaks, and according to the research, higher productivity demands does put you at more risk for burnout. Financial satisfaction. So does your pay kind of match your job? What are your health insurance benefits, retirement benefits? Again, do you feel like you're getting compensated financially for the work that you do as a healthcare provider? Long working hours. So I think this speaks for itself, but do you typically spend time past your designated clinical time in the clinic? I think for Paul and I as academics, the work is never really done. And so there's this, time is often, I don't know, it's not an 8 to 5. We continue to kind of put hours in. And I think many providers are guilty of this as well. Policies and administration. So the structure of your organization, do their core values, their mission, and their vision, do they match with your own? So is there a mismatch here? Are there a lack of policies and organization within the system that really puts you at higher risk for burnout? Professional development and career advancement. So do you have opportunity for development? Do you see a career trajectory? Do you get compensation for things that you have done within your career? And do you have ample opportunities to really advance and to grow as a professional? There's some psychological risk factors that are also associated with burnout. So some of these risk factors include unsatisfactory work relationships, social support, or a lack of mentorship. Mentorship is really important both in the academic setting and in the clinical setting. So really an overall lack of support or social support. Additional risk factors include emotional toll and insufficient coping strategies. So this really is about dealing with patient expectations, dealing with patient suffering, disability, and death, and being unprepared for emotional aspects of care. And I think in light of what's happening with the COVID crisis, there are multiple providers that are, I would venture to say, have been unprepared for the emotional toll. My husband works in the emergency department at Rose Medical Center, and it's a total shift in patient care. And so really, you know, are you prepared for some of these changes that are happening across many of our professions? This emotional toll also could include low levels of perceived self-efficacy and maybe a lack of coping strategies. So your management and supervisor support is really crucial. So do you have a good working relationship with your supervisor? Is your word, you know, are your words heard by those that you work with? Additionally, there are psychological risk factors. So this pressure of being the perfect professional and the perfect mentor, and really sometimes not feeling worthy or not feeling good enough in our roles. In addition to that, we just feel like, you know, if we are a more seasoned healthcare provider or teacher, that, you know, we just have this pressure to feel like we have to be a good role model, and it has to happen 100% of the time. There's some environmental factors. So particularly your work setting. And research has shown that those that work in the hospital setting, particularly intense rehab settings, ICU, emergency department, are at much higher risk for burnout than those that are in other types of environments, including maybe private practices or office or in academics. Inadequate staffing or material resources. So do you have what you need to do your job and to do it well? Is there appropriate funding for things you need? And do you have the staff and the materials that you need in order to perform your job well? And then there's other environmental factors. So maybe not having clear expectations of what you're supposed to do. For those that are practicing in environments that could be litigious, and so OBGYNs and emergency physicians who may be contending more with malpractice lawsuits. Those are other environmental factors that could be kind of playing into your risk for burnout. There are some socio-demographic factors that are also associated with an increased risk of burnout. So poor health status, and that means, you know, do you have musculoskeletal pain? Do you have a health condition that is deteriorating over time? So your own health as a provider does play into being a risk factor. Absence of a stable partner across the research has also been shown to really impact burnout in individuals. And so we also hear a little bit in the literature about having a friend at work, which also goes to the strong social support, but a stable partner is really crucial. This is a report that Paul and I have both read, which is really interesting, especially for those of you that want to try to make change at a systems or organizational level. So taking action against clinician burnout, a systems approach to professional well-being. What we know from the research is that it really does need to come from the system. You at least need to have support in the system. We're mainly going to be sticking to individual interventions for burnout, but for those of you that want further reading, the systems-based approach is really interesting. It's about what you need to do within the organization to create a positive work environment and learning environment and reduce administrative burden, while also improving technology, providing support, and then investing in research. So now I'm going to jump into some of the individual solutions for burnout. And we have we had an Instagram photo contest for the webinar attendees. They could submit a photo on Instagram that demonstrates how they avoid burnout. And so one of our winners here is Jessica Parr. So working in the hospital has been tough these past few months, but fly fishing helps her to fight burnout. So that's an impressive picture, and it looks like you have a fish on the line, so I'm even more impressed.
A few photos. We just picked a few that to be representative here, but Dr. Iyengar, hopefully I'm saying that correctly, we have seen from the news of doctors on the front line. Physician wellness is critical to caring for others. In that regard, my brother and my CU Med 2004 classmates run the Boulder Boulder every year on Memorial Day, finishing at CU's Folsom Field. And then the last one we're highlighting here is Jessica Smith. So her picture of how she tries to avoid burnout camping, and beautiful view in the background there. So we didn't pick these, the
Advancement Office.
The Advancement Office picked them. So the winners are Jessica Smith and Jessica Parr. And so they'll be sending you some swag. So thank you very much for posting and for all that you do. So Amy, you can continue.
So even though we talked about really change does need to happen at a systems level, I'm going to focus now, and so is Paul, on mitigating burnout at the individual level. And so if we go back to this hierarchy, I'm not going to go through all of these, but I think it's really interesting to think about, we want our systems and our organizations to support us, but I also feel like, you have to take some of this on yourself and really determine what can I do for myself, and then maybe try to create change with colleagues and administrators in your system or your organization. And so really some of these things at the individual level really can still make an impact. This was a nice article titled Burnout, Pediatrician, Heal Thyself. And really what came out of this is, based on current research, there is more evidence, again, to support organizational directed compared with physician directed interventions for a relatively small improvement in measures of physician burnout. However, the large organizational interventions are much less common and not always rigorously evaluated. So again, I'm just trying to build the case to really work as an individual to do what you can to mitigate signs of burnout. So I'm going to kind of go through a number of things that kept coming up in the literature and talk about why these might be good individual strategies. Gratitude journaling is something that can be very beneficial, even if it's performed on a weekly basis. And overall, according to the study, can lead to benefits in immune function, lowering blood pressure, improving sleep, and helping to harness more positive emotions, optimism, and happiness, creating less feelings of isolation, and becoming more outgoing and forgiving. So journaling about being gracious. In addition to gratitude journaling, some studies have actually found that gratitude journaling can have equivocal effects of traditional therapy. So I thought that was very interesting. Broken record moments. So what broken record moments are, which are described in an article, are opportunities to have less stress and more energy by optimizing your work environment. And so what this means is, are there menial tasks or things that you're doing every day, maybe as a component of your documentation, that could be automated in a better way? Can you reduce some of these things that just clutter our day and take up time? So reduce writing similar notes in documentation, or reduce recreating exercise programs, which is common in physical therapy. So if you go to the next slide, one of the things that a number of physical therapists have done in my practice environment is they've created what's called dot phrases. And so dot phrases are just templates that are integrated into Epic to help us quickly document without having to kind of recreate every time. And so that's an example of a remedy to a broken record moment. Another thing is creating a life calendar. And so it's not just a work calendar, it's a life calendar. And for someone like me, creating a calendar and sticking to a schedule and some kind of organization goes against every grain in my body. I'm more of extroverted, spontaneous. I don't like a lot of structure. I don't like to plan things. When traveling, I'd much rather fly somewhere and figure out everything once I get there. I don't like to plan. However, I have found this to be extremely helpful. And so, instead of just letting the calendar be work driven, let the calendar include things such as time for journaling, reading, date night, scheduling your exercise in addition to your professional events and meetings. But then also, a colleague of mine taught me to block huge chunks of time in my calendar to work on things that we call deep work, which is maybe writing a manuscript or working on a project that requires really deep thought, and protecting that time for projects that need to get done. This is something else that's changed, how I think has really decreased my stress level, but it's bullet journaling. And so Ryder Carroll, who really developed bullet journaling, he described this as mindfulness disguised as productivity. And really, bullet journaling was really a way to de-emphasize just our digital world. And so the point of the bullet journaling is to live intentionally and productively, and it includes things like to-do lists and quotes, productivity, setting expectations for the day and the week and the month. And then for me, it's accountability for what I call stinky tasks. And stinky tasks are things that I hate to do. So it might be returning a certain phone call, or it might be working on some content or something that I just don't want to do. The journal keeps you accountable for different types of things that need to occur in your life. On this next slide, this is a snapshot of my bullet journal. So this must be from last year, but the right page is always for work and the left page is always for home and personal life. So every day I search out a quote, and that's my mantra for the day. And then I just keep track of everything that needs to get done. And it's really important to put things in increments of time. So you would never want to put on here, I'm going to write a manuscript, because that's not going to happen. But I could put, I'm going to work on a manuscript for 15 minutes. Or I'm going to draft, an outline of something for 10 minutes. That way the skills are, the things that you need to do are just in manageable bits, and you actually feel productive at the end of a day. This is just another informative slide on bullet journaling. I am not a recovering scrapbooker, so my bullet journal does not look anything like this. I don't do artistic things, but it can be whatever you want it to be. And some individuals include diet, exercise, habit tracking, mood tracking, that sort of thing. Boundary rituals, that's setting healthy boundaries between your work and your home. So it might be a release of breath in the car. It might be an action. So for myself, I get home from work, I change my clothes, I put my hat on, and everyone knows that I'm ready. So it's keeping the work and the computer out of the space of the family and letting them know when you're ready to engage and when you've made that line in the sand that you're ready to move from work to your personal life. Involve your leadership the best that you can. We've already talked about the importance of engaging the organization to promote a culture of self-care, but the self-care has to happen first with the individual. Choosing incentives wisely. So if you have productivity that's based on compensation, which financial compensation, could this be changed to something different, off, or more schedule flexibility? Prioritizing oneself. And so we all have to figure out mechanisms to do that. And Paul is also going to go into some strategies, but taking care of yourself is going to impact your patient care and probably even your satisfaction and outcomes, which Paul alluded to earlier. Encouraging a work-life balance, which I think is really hard. The picture that you see on the right is a painting that's been in my parents' home ever since I was a young child, and it was in the bathroom of all places. So I spent a lot of time looking at it. But I guess the point in that is this work-life balance challenge has always been there. So it's nothing new. I think what's new is trying to figure out, continuous ways to make this happen and to be better at it. And there's a number of books out there. Some of this may resonate with some of you, but I personally liked this book on the Happiness Project. And some of it is just trying to create your own optimism, and instead of being heavy, to be light and to just bring more happiness into your life. Here's another book called Learned Optimism. And that's followed by another book, Relentless Optimism. So committing to positive thinking has really been shown to also be really important. Saying no. So if people need a volunteer for something that they're working on, can you volunteer someone else? Sometimes you don't have to explain why you're saying no. And if you are the target person, then maybe you do explain in a gentle way why you aren't available to be able to do that. And you need to set rules and policies on helping other people. Encouraging peer support. So on the right is my clinic, and we hike a 14er every summer. And so being with your peers and having relationships outside of work are really important. The picture on the left is Paul and I on one of our work hikes. And then furnishing resources for self-care and mental health. So encouraging this with your colleagues and encouraging this really within your system. And then being authentic. I think, you know, one of the things that's really hard is if we're not being authentic about how hard things are or where we struggle, then the perception for our colleagues and our students is that we're capable of doing it all, and that's the bar. But I think that's not really real. I think we need to be authentic about where the challenges are and when we're having times of struggle. This was a book that was written by Meredith Mueller, who is on our campus. So coping with caring, and there's some really great tips in this book for managing difficult emotions. And these are other tips that were included from CU Nursing. So this is really another great resource that has some of the same things that keep coming up in the research. Control what you can and influence the rest. So that's a quote my father always used. And so I think of that very often, like, what do I have the ability to control? And if I can't control it in my own world or environment, then I'm certainly going to influence the people that can. And with that, I'm going to turn over the rest of this presentation to Paul.
All right, thank you very much, Amy. So again, I shared some of my story earlier on about burnout, and I'm just going to share with you a couple techniques that I've really embraced and that I think have really saved my career and possibly my life with being depressed and substance abuse and things like that. So expressive writing and mindfulness. So we know that resilience is important in healthcare professions. It's a dynamic process, and it's our ability to bounce back after disruption or difficult times. And the important thing to note is that resilience can be learned. So Nisha Mehta is a radiologist, and she has studied burnout quite a bit. And she likes to use the analogy of a stress fracture versus an insufficiency fracture. So a stress fracture is abnormal stress on normal or resilient bone. And insufficiency fractures are normal stress on an abnormal or non-resilient bone. So we can have the same type of conditions with burnout. So stress burnout happens when abnormal stress is put on a resilient provider. And that's where a lot of us are. I think a lot of us are resilient, but there's just too much that we can have to deal with at work. And then insufficiency burnout happens when normal stress is put on a non-resilient provider. So like Amy talked about, if you haven't been taking care of yourself, your mental health, your physical health, your diet, your sleep, things like that, you're much more likely to develop burnout. So again, Meredith Mueller has done a lot of pioneering work on resilience and burnout and things like that. She did a survey of ICU nurses and found that only 22% were highly resilient. 1 in 5 met criteria for PTSD, high levels of anxiety and depression, and 80% were positive for at least one subscale of burnout. But what she found was that the nurses that were resilient on the scale that she uses what's called the CD risk. The highly resilient nurses were significantly less likely to have PTSD, anxiety, depression, and burnout. So resilience can be learned. So these are just some of the characteristics, and this could be a full 2-hour talk just on this one slide, but you can learn to be more resilient. So the first one I'm going to focus on is expressive writing and written exposure therapy. So James Pennebaker is a psychologist and first wrote about this in the 70s, I believe, and describes it as writing about a stressful or emotionally charged subject helps you put the event into perspective and gives some structure and organization to those anxious feelings, which helps you get through it. So this article by Bikey talks about the emotional and physical health benefits of expressive writing. There's over 1,000 articles on the benefits of expressive writing. It can improve performance, decrease stress, burnout, pain, depression, anxiety, and so on. So it's simple. The writing instructions are, I'd like you to write for 15 minutes about your very deepest thoughts and feelings about a traumatic or important emotional issue that has affected you and your life. So you're encouraged to really let go and explore your deepest emotions. So all those thoughts that are running around, the diarrhea of the brain that are just running around, you just take a pen and a paper and you just start writing and you let it all come out. And from the research, it's pretty clear that having a pen and paper or pencil and paper is more effective than just writing on your computer. So get old school, get out your pen and your paper and start writing things down. And don't worry about spelling, grammar, sentence structure. The only rule is that once you start writing, you write until the designated time is up. And 15 minutes has been used in the literature, but 5 minutes has been used as well. So just start to experiment with that. So there's 3 theories about why expressive writing is beneficial for us. The first one is inhibition theory. So when we are stressed about something, we tend to bury it. We put layers over the top of it. I don't want to think about that right now. So I'm just going to put that in the back of my psyche, but it's still there. It still burns and it still causes you to change your behavior. The second one is exposure theory. So by writing, you'll be surprised if you try this, and I encourage you to do this tonight. You'll be surprised at the things that come out. Things that you didn't think you were thinking about or stressed about will come out. So it forces you to face the facts. And then the third one is cognitive processing. So you can look at the statement that you write down, I'm a bad PT, or I'm a bad physician, or I'm a bad nurse. And you can look at it and say, is that really true? No, that's not true. I know that I'm a good provider. That's just a thought that I'm having. So it really forces you to confront those things. So Tonarelli talks about using expressive writing for healthcare providers. And the great thing is it's a brief intervention, short time commitment, can be done anywhere with limited resources, and it doesn't have to be done at a certain time. I like to do it at night before I go to bed, because otherwise I just lay in bed and my brain just runs in circles and circles and circles. But if I can do this, if I can purge my brain and kind of get the diarrhea of thoughts out, it helps me sleep a lot better. So in this study, she just had healthcare providers write for 15 minutes for 3 days. And you can see the trend for negative thoughts and emotions, feelings went down, and positive thoughts and emotions went up. So just a short study, but it did demonstrate that there's benefits for this. And there are systematic reviews and meta-analyses. This included 10 studies in the systematic review and 8 in the meta-analyses, but it showed that expressive writing alleviates symptoms of trauma and avoidance and significantly improved general psychological health in caregivers with a moderate effect size of 0.46. So David Hanscom is a spine surgeon who just got tired of seeing all these quote unquote failed back syndromes, patients that had had 20 back surgeries, and started treating a lot of chronic pain patients. And he's really embraced this in all of this research. And what he tells patients, and you can use this with your patients, your chronic pain patients, just write down your thoughts and feelings from the day, let everything kind of flow out. And then the cathartic part is you instantly destroy them. You just tear it up and throw it away. Again, it's like flossing your brain, clearing out those thoughts, and it helps you be a lot more present and in the moment, which leads me to my next intervention, which I think really saved my career, saved my life, and that's mindfulness. So Jon Kabat-Zinn has really pioneered a lot of this, and his definition of mindfulness is paying attention on purpose without judgment. So it's as simple and as complex as that. So slow down, pay attention to what's happening right now. Don't think about yesterday. Don't think about tomorrow. If you have thoughts that come into your brain, acknowledge them, but don't latch onto them, and don't judge yourself for having these thoughts.
It's paying attention.
So I'm going to skip that because we're running a little short on time. But the book that really changed my life as far as mindfulness is Eckhart Tolle's book, The Power of Now. If you haven't read it, I highly recommend it. But he's got some really powerful quotes. First one being, realize deeply that the present moment is the only thing you ever have in your life. And the one that slapped me in the face is, he said, when you die, it will be now. So the present moment is the only thing you ever have. The only place that you can learn and love and interact. And research shows that we're happier when our mind isn't wandering. And mindfulness is not something you do. You don't have to sit down on a cushion. You don't have to sit in a dark place. You know, mindfulness is just being present. It's a way to be. So there are, last search I did was 2 weeks ago on mindfulness in PubMed. There were 16,784 articles on mindfulness. And the benefits: it decreases burnout, improves happiness, improves empathy, increases creativity and mental clarity, decreases anxiety and depression, positive affect, and interpersonal growth. So how does it make you a better clinician? You really start to listen rather than hearing your patients. You're more empathetic and compassionate. The patient feels more supported. It improves your therapeutic alliance, decreases your psychological distress and your callousness, improves quality of care, outcomes, and reduces medical error. And then for our patients, you can use this with your patients. Just teach them some basic mindfulness things that I'll go through here. It improves immune function. It decreases cortisol levels. It causes genetic switches to be turned on, that your system is either under fight or flight or not. It improves heart rate, blood pressure, sleep, decreases pain, and can actually grow brain. If you practice mindfulness as little as 20 minutes, 4 times a week, you can actually change the structure and the wiring of your brain. And this is just one systematic review looking at mindfulness in healthcare providers, 39 studies, but it improved burnout, stress, anxiety, depression, and empathy. So the basics of mindfulness, just could be in your chair in front of your computer documenting for your patients, and just observe the present moment as it is. And judgments will come up, but you just let them roll by. Don't latch onto them. Just say, I'm kind of judging the moment right now. But then return to observing the present moment as it is. And the final one is be kind to your wandering mind. You're going to have lots of thoughts that crop up in your head. So just some basic practices to try. Object meditation. So take something that's special or interesting to you. Could be a flower, could be looking at a tree, and just focus all of your senses on that. Bring yourself into the present moment and just tune in to that. And if you have thoughts that come back in, notice them, don't judge them, let them go, and bring your attention back. So this really works really well. It takes some practice, but it's not that hard to do. Mindful eating. When's the last time you tasted your meal? Most of us eat in between tasks, or we'll be eating while we're documenting, or eating while we're doing our emails, or that kind of thing. Slow down. Taste the food. Take the time to really appreciate what's going on at that moment. Mindful walking. So every morning I like to walk my dog in the morning. I leave my cell phone at home. And my only goal is to pay attention to everything that's going on around me. What do I see? What do I hear? What do I smell? How does my body feel as I'm walking and moving at 5:30 in the morning? And then one thing I like to do before I start treating patients, I call it the cleansing my palate, the 5 senses exercise. And I like to use Altoids, but the first thing I do in clinic, we have this nice tree that is right outside the window. So I'll focus my vision on that, and I'll look at the tree and acknowledge the tree. Then I'll close my eyes and pay attention to what I hear. And it's usually the sound of the air going through the ductwork, but I'll hear people milling around and hear conversations, but I'm tuning in to what's happening at the present moment. And then I'll take an Altoid out of a tin and I'll feel it. You know, they're kind of chalky. It's got an interesting texture, so I can really tune into that. Then I'll smell it, because Altoids are pretty strong smelling overall. Tune in onto that. And the last thing I do is pop it in my mouth and taste it, and really focus on tasting the Altoid. And that really sets the stage for me to be present for my first patient of the day. So I'd encourage you to give a try to that. So where do you start with mindfulness? So these are the best mindfulness apps of 2019. The Mindfulness app, Headspace, Calm, Mind Body, Buddhify, Insight Timer, and Smiling Mind. So get one of these. A lot of them are free. Headspace does cost some money, but they are offering free access to their mindfulness and meditation app for healthcare providers for 1 year. So if you're a healthcare professional, all you need is your national provider identifier. Or if you're a nurse and you don't have an NPI, you just provide your organization information to verify your credentials, and you can get this for free. So I had all of our students get this, and it's really a great app, and it's got a ton of resources. So give that a try. So the great thing about mindfulness is you can't do it wrong. If you can slow down, pay attention to the present moment without judgment, you are practicing mindfulness. So I'd encourage you to, when I first started doing this, I set a timer on my watch for every hour to go off for me to just tune in to the present moment. And then pretty soon it became a habit. So give it a try. So that's all we have for you today. And we have a few minutes, I think, left for questions. So we can open it up there.
And I think if you're able to put questions in the chat, that seems to be the mechanism that we're able to see. And someone asked if we could share the resources. So I think Megan will be sending out an email that has access to some of the names of the books and the resources.
And we can make a PDF of our slides too and send that out so that everybody can have it.
Someone asked if we could send out the information for Headspace.
Yeah, and here it is. You type in Headspace for healthcare providers on Yahoo or Google. It should come up to it, but here's the link. Headspace.com/health-COVID-19. But it's a great way to structure it. You can set reminders so it goes off to force you to practice mindfulness. I set mine at 10 p.m. so I can start to gear down, wind down for the day, that type of thing. So
one of our PT colleagues just said that Headspace also has a discount for students.
Management says you're fully staffed and that you just need to be more organized. It feels like gaslighting. Amy, you might be able to speak more to that.
I think that's a really good, not good. I think it's an understandable comment. And I think there's so many factors that could play into that. And I think in the beginning of my career, I just felt like I could never keep up because the expectations for productivity were so high. But I felt like there were times in my career when I talked to management about there are certain patients that you're going to see clinically that just can't be seen in the small amount of time. And so sometimes trying to negotiate to expand time with certain patients or, to make changes and be more flexible with your schedule. But I don't know that I can disagree that sometimes you feel like you're working so hard, but that you're just barely meeting the productivity standards. Paul, do you want to add to that?
Yeah, I think just having a leader who has been in your shoes before. A lot of times when you get leaders who are not healthcare providers, who are number crunchers, bean counters, that kind of thing, they don't get it. So, maybe asking them to walk a mile in your shoes and hang out with you for a half day or something and see what you have to deal with, see what all the administrative burden, the EHR, the number of patients that you have to see, the chaos that you deal with on a daily basis. A lot of times that's eye-opening if they'll spend the time, maybe not a half day, or an hour or something like that. So, but it is challenging.
And further, Jillian, I was one of those providers that always felt like I was treading water all day and it was so stressful. And I did look within myself to figure out ways that I can improve my own processes because I could talk to patients all day. I mean, I love sitting in the chair and hearing what they have to say in their story. And I'm not saying that you should sacrifice that, but there were other things that I was doing with my efficiency that I had to tighten up a little bit better. And it made my efficiency in clinic just that much more productive.
All right, so I think we're going to turn it back over to Tim.
Great. Yeah, well, I'm sure I speak for everybody. I know I saw quite a few people on the chat function saying the same thing, but thank you to both Dr. Mintken and Dr. McDevitt for your time, and for really sharing not just your expertise, but also your own personal struggles with this group. We certainly do hope that you'll be able to join us for the next event in this series on May 27th, which will be featuring Ann Spader, who is with the Warrior Canine Connection. And she'll be speaking on the positive outcomes of human-animal relationships. I want to mention before we finish up that you are invited to attend an optional social component, which we've added to this webinar. We'd love for you all to have an opportunity to connect with your fellow alumni virtually. There should be an additional chat function that'll be available. And also just want to remind you to turn off or turn on your cameras when you go on there so we can all see your beautiful faces. I believe the speakers will be available there for additional questions if you do have any. And yeah, just want to thank you all again so much for tuning in, and we hope to see you in 2 weeks.
All right.
Thank you very much for having us. We really appreciate the opportunity, and we hope that some of this information is helpful.